ago, I had done some television. Katie Couric, I was on the Today Show with her a few times and some other shows, but just sort of as a talking head. And I get a phone call from Katie Couric saying, would you like to be the medical correspondent for the CBS Evening News? I said, do you have to know anything? She said, no. I said, great, I can do that. So fade out, fade in. It's now 8 years later. I've done nearly 600 segments. And every week, this turns out to be the greatest continuing medical education gig in the world, because I can talk to anybody. I talk to the people who wrote the studies. Every week, I would estimate I review about 50 studies. So if you do the math, that's about 20,000 articles. So some of the top headlines, I'm going to go through this quickly. I think you know them: obesity, cardiovascular disease, cancer, Alzheimer's, mental health. These are the stories that you see us doing over and over and over again. They're major issues. 2/3 of American adults are overweight or obese. Obesity has more than doubled since the 1960s. The consequences are enormous: diabetes, cardiovascular disease, cancer, and dementia. Cardiovascular disease, we've done pretty well, right? The death rates have gone down dramatically, but it still remains, with stroke, if you add them up together, and even heart disease alone, the #1 killer in the United States. And cancer, we've also done very well with. Rates, every year it goes down 1% or 2%, even 3%. We do terrifically with colon cancer. It still remains neck and neck with cardiovascular disease, just the #2 right now. But as we get to a more aging population, I think it's going to overtake it. But we have a long way to go. And here's the big thing: 2/3 of cancers are preventable. 2/3 of cancers are preventable. That's a huge number. Alzheimer's, particularly devastating. We all know that, and it's been mentioned in the more dementia is going to be a huge thing. Not that many people got Alzheimer's in the early 1900s because people didn't live long enough to get Alzheimer's. It's predominantly people who are 65 and over. 5.2 million Americans. By 2050, that number may triple to 16 million. And the direct costs are over $200 billion. But just as important are these indirect costs of people who are the caretakers, unpaid caretakers, another $200 billion or so. And that amounts to about 9 hours of unpaid labor a day. And mental health, we've seen all the shootings that have gone on and the stigma then afterwards that becomes attached to it. Following one of the shootings where the issue of Asperger's being linked to violence came up, I went on that night and said there's no link between Asperger's and violence. There's a lot of misunderstanding. There's a lot of stigma. This is a huge problem. What gets in the way of wellness? There's them. And by them, I mean the forces out there. Now, that may be doctors who are insensitive, who don't listen. We heard the fury in the voice of the woman who felt she wasn't being listened to. And that is so true out there. When you talk to patients about what makes them angry, listening, not listening, is right up there at the top of the list. Not having enough time, being patted on the head, you're okay, when you're not okay, not communicating. These are big them things. There's also them companies or forces in our society. So the them companies that make junk food and try to not just make the junk food, but create an environment where we eat when we're not hungry. Then there's us. There are responsibilities that come with being a patient and an active patient. So there's a thing called shared decision-making now. Here's the risks of doing it. Here's the benefits. And by the way, here's what happens if you do nothing at all. So patients have to have that ability. That's why it's a shared decision-making. And that means not coming in and saying, what medicines you are. The little green one, the little white one. Kill me now. Come in, with a list of the medicines or brown bag it. Bring a bag of the medicines. And I love that. I tell people, just bring in your medicines. And by the way, medicines are also the herbs you're taking because they're drug-herb interactions and all the rest of that. If you do have a problem, know your family history. If you have a problem, understand what we're going to want. We're going to know when did the problem start. If it's a pain, describe the pain. Is this the first time you've ever had it? What makes it better? What makes it worse? What's the quality of it? These are the same questions we're going to ask over and over again. So do your homework. So patients need You have to have time. And I think one of the big threats to wellness is the fact that we now have a system. In the old days, when we didn't have anything but leeches and drilling holes to let the evil spirits out, right? We had a lot of hand-holding. Well, it turns out there's a lot of value in that ritual. And then there's it. So it can be the system, and that we're talking a lot about that, the system, the healthcare system that rewards, that has perverse incentives. It can be the environment. The environment can be toxins. We live in a toxic environment. What are we going to do about that? Or it could be the community. We have healthcare inequity here, like crazy. In particular, African Americans, American Indians, Alaska Natives, but all across the board. And you just saw the New York Times May 10th had an article about 400,000 people who are in Virginia who are not able to qualify for Medicaid, but they're not eligible for the federal subsidies, so they're sort of out of luck. But if they went across the state line, they would be able to get the Medicaid because it's a different program there. So this is a huge part of the problem, and when we talk about holistic medicine and changing the community and changing the it along with the them and the us, we have to include that too. Thank you very much.